The land of the rising sun faces a new and formidable threat. A silent storm gathering in its hospitals and homes. A surge of infections, baffling in their virulence and speed, has gripped the nation. Doctors and nurses, veterans of countless medical battles, find themselves on the front lines of a fight unlike any they've seen. Fear and uncertainty cloud the normally vibrant streets as news spreads of a relentless enemy, a deadly bacterial infection known as STSS. Reports from hospitals paint a grim picture. Intensive care units overflow with patients battling for their lives, their bodies ravaged by the relentless infection. The elderly and the very young, the most vulnerable members of society, bear the brunt of the outbreak. Health authorities scramble to contain the spread, their faces etched with worry as the number of cases continues to climb. STSS, short for Severe Toxic Shock Syndrome Streptococcus, is a particularly aggressive strain of bacteria known for its ability to unleash a cascade of toxins within the human body. These toxins wreak havoc on vital organs, leading to rapid organ failure and, in severe cases, death. The speed at which STSS progresses is alarming, often leaving doctors with a frustratingly small window of opportunity to intervene. Adding to the challenge is the bacteria's resistance to many commonly used antibiotics. This resistance, a growing concern in the medical community, makes treating STSS infections incredibly difficult. What were once considered reliable weapons in the fight against bacterial infections are now proving less effective, leaving doctors searching for alternative treatment options. Japan, known for its robust healthcare system, faces an unprecedented challenge in containing the STSS outbreak. The sudden surge in cases has overwhelmed hospitals, stretching resources thin and pushing medical professionals to their limits. The situation highlights the vulnerability of even the most advanced healthcare systems when confronted with a rapidly spreading infectious disease. The Japanese government has responded swiftly, implementing emergency measures to bolster the healthcare system's capacity. These measures include increasing funding for hospitals, mobilizing medical personnel from less affected regions, and setting up temporary treatment centers. However, the sheer scale of the outbreak continues to pose a significant challenge to containment efforts. Section 4, a race against time, treatment, and prevention. Scientists and researchers across Japan are working tirelessly to understand the STSS bacteria and develop effective treatment strategies. Their efforts focus on developing new antibiotics that can overcome the bacteria's resistance mechanisms and exploring innovative therapies that target the toxins produced by the bacteria. The race is on to find a way to stop this deadly infection in its tracks. While research progresses, public health officials emphasize the crucial role of prevention in curbing the outbreak. They urge citizens to adopt strict hygiene practices, including frequent hand washing with soap and water, covering coughs and sneezes, and avoiding close contact with sick individuals. Early detection and isolation of infected individuals are also paramount in preventing further spread. Section 5, the global threat. Could this be the next pandemic? The STSS outbreak in Japan serves as a stark reminder of the interconnected nature of global health. Infectious diseases know no borders, and what begins as a localized outbreak can quickly escalate into a global threat. The ease with which people travel internationally in today's interconnected world means that diseases can spread rapidly across continents, as the COVID-19 pandemic demonstrated. The international community watches the situation in Japan with a mix of concern and caution. The World Health Organization, WHO, has classified the STSS outbreak as a public health emergency of international concern, recognizing the potential for the disease to spread beyond Japan's borders. This designation serves as a call to action for all nations to strengthen their surveillance systems, prepare their healthcare systems, and educate their populations about the risks posed by STSS. Section 6, the importance of global cooperation and preparedness. The STSS outbreak underscores the critical importance of global cooperation and preparedness in the face of emerging infectious diseases. No single nation can tackle this challenge alone. International collaboration is essential for sharing information, coordinating research efforts, and providing support to countries struggling to contain outbreaks. Investing in robust public health infrastructure, including strong surveillance systems, well-equipped laboratories, and a trained healthcare workforce, is crucial for detecting and responding to outbreaks quickly and effectively. Equally important is investing in research and development to develop new diagnostics, treatments, and vaccines for emerging infectious diseases. Section 7. A call to action, what you can do. The emergence of STSS serves as a stark reminder that infectious diseases remain a significant threat to global health. While the situation in Japan is concerning, it is not a time for panic, but a time for action. We can all play a role in protecting ourselves, our families, and our communities from the threat of infectious diseases. By adopting simple yet effective hygiene practices, such as frequent hand washing, covering coughs and sneezes, and staying home when sick, we can significantly reduce the spread of germs. Staying informed about emerging health threats and following the advice of public health officials are also crucial steps in protecting ourselves and our communities. Together, we can work towards a healthier and safer future for all.